coronavirus, and this begins with you, it begins with me. We have to find the discipline for personal hygiene, for community hygiene. The Minister of Health has continued to remind us about the basics, to keep our hands clean, to keep our faces clean, to keep surfaces clean, to keep our homes clean, to keep our communities clean. We will have to look deep to find the discipline, not to unnecessarily go to the market. By doing that, we stop the spread of the virus, the coronavirus, and we are able to save lives. We have to find the discipline in us to not unnecessarily go to the shops, to the bars which are already closed, to ensure that we avoid gatherings, to ensure that we do not necessarily have to attend funerals. If we are going to fight the coronavirus and beat it, the discipline has to begin with you, it has to begin with me, it has to begin with all of us. We have to find it in ourselves, to find that strength, that resolve to stay at home. If we stay at home, we stop the spread. We stop the spread, we save lives. And once again today, we are going to have an update on the latest on the COVID-19, the coronavirus in Zambia. The Minister of Health, Dr. Chilufya, is now ready to share with the nation.
Well, thank you very much, Dora. And members of the press, countrymen and women, today, Saturday, 28th March 2020, I'm privileged to update the nation on the COVID-19 epidemic in Zambia. The COVID-19 epidemic has been a public health threat that has been challenged by a multi-sectoral and robust response in the country as ordered by His Excellency President Edgar Chagwa Lungu, and in the true spirit of transparency and ensuring that we all have the information to inform what next action, we continue to update the nation on the current state of the epidemic. I reiterate that we will firmly be fixed on President Lungu's vision for universal health coverage, integral to which is public health security, and we will ensure that resilience in our health systems to continue routine health services is watched. Today, Zambia has recorded another 6 laboratory-confirmed COVID-19 cases following laboratory confirmation in the last 24 hours. 3 of the new cases are part of the cluster with history of travel to Pakistan, and the other 3 are contacts to the confirmed COVID-19 cases. This brings the total number of cases in Zambia to 28. Globally, 597,267 cases have been recorded, and 27,365 deaths have been confirmed in 199 countries and territories. Africa alone has recorded 4,146 cases with 115 deaths in 47 countries and territories. As I mentioned yesterday, all contacts to confirmed cases are being followed up and tested. There were 20 golfers that traveled to Dubai. We managed to round up all the 20 golfers and we tested them. And I'm happy to report that all the 20 golfers have tested negative. And we tell those golfers to stay home. The total number of individuals tested by end of yesterday is 335, out of whom we have these 28 that are positive. Our surveillance system is alert, and anyone picked out through our ports of entry or through the alertness of the community who are calling our call centers are being tracked and are being tested, and these are the results that we're giving. The teams that are working in the surveillance unit are working very aggressively to ensure that any suspects are followed up, and those that are symptomatic are immediately admitted into isolation as we investigate their status. Those that are negative are released, but only after they are asymptomatic, but those who are positive continue to be with us. Anyone who is positive, we are creating a tree to find every contact, and this is the reason why we've managed to find all the contacts, including those you fly with when you're coming back home. This is the reason why we managed to track that person in Rwanda. This is the reason why we managed to track that person who just picked the contacts from the airport. Distinguished ladies and gentlemen, our rapid response teams are aiming at early detection. They're aiming at testing and containing all potential cases, and will continue to respond to all alerts. I urge the community to continue engaging with our staff in our call centers, as I thank the community that have communicated with us aggressively on any suspects. Let me appeal to the rest of the members of the community to be part of the surveillance team and report any suspects to our teams. To ensure effective screening at all points of entry, the government, with the support of partners, has secured a screening facility at the Makeni Dry Port. And all the buses that came from outside yesterday docked at Makeni Dry Port, and we managed to screen the clients with a higher level of efficiency. More thermal scanners have been procured, and these will be stationed at the various ports of entry, and this will ease the screening process so that we avoid crowding. To improve the response to alerts and follow-up of cases, we've also deployed 17 vehicles and 3 ambulances for Lusaka district, where most of the cases have been, and many alerts have been reported. All provincial health officers have been supported with adequate transport for surveillance and resources for preparedness and response activities. I want to confirm that Eastern Province, Luapula Province, Copperbelt Province, all the other 7 provinces are doing exactly what Lusaka is doing. And any suspects they are quarantining, either self-quarantining or in dedicated quarantine facilities. Distinguished ladies and gentlemen, this fight can be won if only we heed the call from His Excellency President Edgar Chagwa Lungu to ensure that we avoid gatherings and crowded places. In other words, staying home. Let's ensure we hand wash, and let's ensure clean environments, and let's ensure that we are alert. The index of suspicion must be heightened, and we must continue to report any suspects. It will take discipline, collective discipline, unity of purpose for us to win this war. We will continue to aggressively do surveillance at all ports of entry and at community level, and will continue to do contact tracing for all the suspects. Do not despair because of the numbers we report daily. It is because of the aggressive surveillance and disease intelligence system. As the matrix of contacts tapers to 0, you will see the numbers that are positive equally tapering to 0. But let us ensure that we do not contribute to increased numbers by avoiding contact with people with possible infection with COVID-19. This is achievable if we adhere to the basic discipline, the basic guidance that His Excellency President Chagwa Lungu provided. We'll continue updating you on the state of the COVID-19 outbreak, and we'll continue informing you, and next week we will be assuring that on a daily basis at 11:30 we come to you with the latest update. And to ensure that we do not disrupt your planning, we will be with you at 11:30 every day. Thank you.
Thank you so much, Dr. Chilufya. So confirming now 28 cases in Zambia, and all these are related to the initial cases. No new cases out of that matrix, right, Doctor?
Yes.
Okay, and we confirm that the cases are now in Lusaka and in the Copperbelt only.
Yes, Lusaka has 26 cases, and the Copperbelt has 2 cases. And the but important point you've mentioned is that all the cases are just in 2 compartments. There are 2 that came from France and no matrix, and the 26 are strictly within the Pakistani matrix. And if we maintain social distancing and stay home, we can keep it that way. Yeah, and that's why even as we commiserate and stand in solidarity with those that have been affected in other countries and pray for the souls of those who have departed to rest in peace, let us ensure that we don't bring this closer to home. Yes.
We don't want
new cases.
People must stay at home.
Yeah.
The gophers, please stay at home.
Yes.
Do we have questions from my colleagues here? Yes, please. Thank you.
Good afternoon, Mr. My name is Brian from ZNBC.
Yes.
You did talk of adherence to the presidential directives. I just want to find out, try to make a follow-up on the directive that everybody who's coming from outside the country, especially the foreigners from affected places, will be quarantined at their own expenses. We did see a plane that came in with some people from some places that can be considered to be hotbeds, and there's no any sort of quarantine that is taking place. We want to find out maybe when that is likely to start and which places are connected to find. Thank you.
Well, thank you very much. Remember, the president guided that we'll restrict entry into the country, and for those who will come in, there will be under self-quarantine if they are from COVID high-risk countries. And he made it categorical that while Zambia will remain open to people coming in, they will be subject to the rules provided for under the Public Health Act, SI 21 and 22. So Zambia admits people from outside, returning citizens too, but they will be quarantined if they're from COVID high-risk countries, and they will be quarantined either self or in dedicated places. We are going towards more of dedicated places of quarantine. So there is no one who is coming into the country today who is breaching the dragnet. So we will be able to quarantine people in places that are designated quarantine places, and ensure that they are tested and they do not have any symptoms before we integrate them into society. This is to protect the public from any new cases. And as the minister emphasized here, it is important that we don't have new cases in the country. This is only possible if we, one, stop new cases through human-to-human transmission and stop other cases from coming into the country. So we're already executing the guidelines that the president pronounced as of midnight yesterday. I probably should take this opportunity, Minister, to thank the church, for coming out strongly, emphasizing the need to avoid human-to-human transmission and ensure that they do not gather in their places of worship and they worship from home. This is a strong voice of reason, and it's a strong voice of advocacy. We thank the church for the leadership, we thank the church for the advocacy, and for supporting President Lungu's fight against COVID. We also want to thank the bar owners, the restaurant owners who complied with the directive to ensure that they close down and ensure we do not create any platform for people to gather. And cooperating partners who have been with us in this fight, including the corporate world that have been giving towards this fight. We also want to thank them most sincerely.
Maybe just for clarity from the question that was asked, is Ethiopia Airlines arrives in Zambia, there might be 1, 2, 3 people showing signs. Those you put in medical facilities immediately, right, doctor?
Yes.
What happens to all the others, whether they be foreigners, visitors, residents, or even citizens? They are not showing signs, but they are coming from Dubai, they are coming from Europe, they are coming from America. What is self-quarantine? I think this is the term that many Zambians are confused about. What is self-quarantine? What happens? You take that person from the airport to their home because they're not coughing, but they're from a high-risk country, or what happens?
I see you got nostalgic memories of the time you were interviewing people. Yeah, that's a very good question, and I think it's important that we clarify this. Let us begin with the term quarantine. Quarantine is just putting you away in a safe space where you are away from contact with any other individual who you would possibly infect. So now, quarantine could either be self, we put you in your own home and say, be in your own room and be alone. People who give you food will drop the food at the doorstep and you get the food. You'll have your own facilities and stay in that space for 14 days. Since the incubation period is 2 to 14 days, once you complete the 14 days, we'll say, well, you don't have symptoms. And even as you're under that self-quarantine, you are actually going to be in touch with our staff who are doing surveillance to ensure that the moment you exhibit a symptom, we quickly take you into isolation facilities and we will test you and confirm your status. That is self-quarantine. The second form of quarantine is where we actually take you into our own designated quarantine area. We will pick you, we'll admit you into the country, and we'll say you're from a COVID high-risk country. Yes, you don't have symptoms, but we'll quarantine you in this designated place. If it's a hotel, at your own cost. If it's a facility that we have put up as government and say we're going to, out of solidarity, keep you there, yes, but it is mandatory. We'll have our staff who check on you on a daily basis and ensure that you do not develop symptoms, and if you do, we move you from that quarantine space into a facility now where we commence active clinical management. So quarantine is mandatory. And I repeat, His Excellency President Edgar Chagwa has not banned entry of foreigners into Zambia. He has said, come in, but you will be quarantined for 14 days until we certify you free of COVID-19 and we'll reintegrate you into society. We've got very, very stringent measures to ensure that we certify you COVID-19 free before we integrate you into society. And this is possible and it's becoming more efficient by the day. So feel free to come, but you will respect the rules that we've set up through the Public Health Act, SI 21 and 22, and capped by what His Excellency President Edgar Chagwa gave in his address to the nation.
Any other question? Okay, go to the lady there.
Any signs of healing? And then the other question is, during this period, Zambians do experience bluish, in nature. Do they suspect it to be COVID? Most people are scared to go to the hospital now because of this. Any advice?
Thank you very much for those, pertinent questions. When you test COVID-19 positive, we admit you, whether you're symptomatic or not symptomatic. We'll keep you in our facilities under the careful watch of our dedicated experts. We will only discharge you when you show a COVID-19 negative test. That may take up to 8 weeks. So as we speak today, the couple is very stable. But because 2 days ago, when we retested, they were still positive, they're still under our custody. The reason we will not discharge them into public today is because we don't want to create another focus of infection to begin spreading human-to-human infection. So we will release you from our facility as soon as you test negative. So you must not only be asymptomatic, you must be COVID-19 negative. It may take up to 8 weeks. It is the reason why government is working closely with cooperating partners, with the corporate world, to identify safe spaces where we can disaggregate those who are positive and symptomatic and ill and require clinical case management by our experts, those who are positive but are asymptomatic and just require us to keep them away from the public, and those that may be symptomatic but are negative and we're still, or symptomatic but we're still investigating them to find their status. So that's the reason why all the provinces today are working with the corporate world, with other sectors, to identify such spaces. And as we speak, we have adequate space.
Just for clarity, doctor, if somebody is coughing, somebody is sneezing, somebody has a temperature, somebody has a headache, should they assume COVID first until proven otherwise?
Yes.
I think that was the question. If anybody has a flu, should they assume it's COVID until proven otherwise?
Yes. In fact, that was the second question that you asked, which again is a very important question. The case definition for COVID-19 is 1, contact with somebody with COVID-19, or travel to a country with COVID-19, plus those symptoms: a headache, a flu, chest pains, difficulties in breathing, a fever, body pains. Now, you must take note that in the beginning of this epidemic, we were so much talking about travel to a COVID-19 high-risk jurisdiction. But now, we have COVID patients here. So contact with such a person may as well preclude travel to such a jurisdiction. There are people who inadvertently will come into contact with someone who has COVID-19, a bit non-symptomatic, and then develop symptoms. That's why when we find such a situation, we'll track everybody that they've been in contact with. This is the reason we're saying social distancing, stay home, stay away from contact, because you may just be in contact with someone who has COVID and is asymptomatic and may actually still transmit to you.
Okay. Next, Steve.
Yes, yes, I wanted to find out what will take on the continued course for a complete lockdown or shutdown, and then are there any measures that government is pondering on with regards to public transport?
Well, let me just reaffirm the position that His Excellency President Edgar Chagwa Lungu has taken on this matter. Avert a health catastrophe, keep the economy going. That's the delicate balance. Health and economic growth, or economic health, are inextricably linked. So, as we talk about ensuring we have the economy running, we want to avert a health catastrophe and ensure that we don't bring the economy to its wheels. This is the reason why President Lungu has always called for a scalable plan. And this is the reason why interventions are scaled up on a daily basis informed by the data that we bring in. Look, I must emphasize, the term lockdown sounds very fancy, but what does it mean? Lockdown does not mean that you stop buying food. Lockdown does not mean you stop selling food. Lockdown does not mean that everything grounds to a halt. This is the reason why, in this scalable plan that President Lungu has put up, we will ensure that, one, we will advocate for people to stay home, to exercise social distancing, to observe all the basic principles of hygiene, hand washing, and clean environments, while allowing trade to carry on. We have said we'll restrict passenger movement, but we're saying cargo movement should continue. Cargo flights will carry on through the international airport. Trucks bringing in cargo will be allowed in and they'll be, allowed out. The people who are bringing in the cargo, they'll be screened, they'll be followed up. And so we are saying we are delicately balancing the issue of the health of the people and the economy. But get it very clear, the economy is not delinked from the health of the population. Because if the population is morbid, if the population is struck by an epidemic, the economy is deprived of the productivity that you so require in a healthy workforce. That's why our prime priority is to ensure that people are healthy. This is the reason why we have the technical arm of government, that is a technical platform that is multi-sectoral in nature, that focuses on health security to protect the nation from health hazards so that we can shield our economic development program from a potential shock of an epidemic. So everything is delicately balanced.
I did speak with Honorable Kafwala, the Minister of Transport. I know he's engaging with public transport owners to ensure that we come up with even better measures in how we're going to keep passengers and those businesses operating at the moment. As Honorable Chufe said, we need some of these essential activities to happen. Police people have to go to work. Nurses have to go to work. People who work in shops where we sell food have to go to work. And how do we provide an environment where we avoid infection because they're getting on that public transport? And this is the time that Honorable Chufe is saying, is meeting with public transport owners, I believe, Monday, to ensure that they inform the nation on how we're going to do this. But already, Ministry of Health advised keeping public places clean, including bus stops, including buses. We saw him and Dr. Banda go out to Millennium, to Kulima Tower bus stops to ensure that there is sensitization. So I think the first responsibility is with each one of us. Each one of us must take personal responsibility that our space is clean. Next question.
Thank you. My name is Chinisha from ZNBC. This is a question that has come from our ZNBC Facebook page, and someone is asking, why not quarantine everyone who comes into the country? Wouldn't this be cheaper than effecting a lockdown in the event that the disease spirals out of control?
Well, thanks, Chileshe, and thanks for that question from the blogger there. Now, that's what we're doing. Everybody who comes into the country will be quarantined. So we're not saying don't come. We're saying if you come, we'll quarantine you. It's mandatory. And remember that the reason we signed Statutory Instrument 21 and 22 is to invoke special powers to protect the public from potential hazards. So there are things that ordinarily do not apply. But because of invoking those provisions in the Act, those things apply in order to protect the public from infection. So when we say you can't gather beyond the number 5, that is the provision that President Lungu referred to when he said when you are 50, ensure that you live within the public regulation, because you have to apply that you want to have this congregation, this gathering of 50, and it's beyond 5, and then we'll give you authority if we assess and we put in certain guidelines. There'll be social distancing, hand washing, and so on and so forth. You don't meet those, then you can't meet that. Anyone coming, even for funerals, any gatherings. That's why we, hail the wisdom of the church leadership in the country, or the religious leadership in the country, because even the Muslims and many other faiths have actually gone that route. That's why we applaud them, because they have seen that realistically it is not possible to have this number of people 1 meter apart and conducting business as usual. So to keep the public and the congregants safe from infection, that's why they have done a circular to align to President Lungu's order for a ban for 2 weeks, which shall be reviewed after those 2 weeks. But let me add one more thing there, that lockdown does not preclude essential services. Lockdown does not preclude essential services. And as the data comes, as the epidemic evolves, do not be surprised if one day the president comes to address the nation with even tighter restrictions that may be close to what we call a total lockdown. But even then, it shall not preclude buying food, selling food. There are many models that are possible, and that we're looking at, that we are ready for in case the epidemic goes out of hand. For instance, Cabinet Office has been directed by the president to distinguish clearly which are the essential services, so that in the coming week or so, we'll only allow those people who are essential workers to come to the offices. The rest may need to work from their homes using technology. Today, we're able to hold meetings with many people in various places, anchoring on Zoom technology, anchoring on video conferencing, virtual meetings. We attended a meeting that was addressed by the World Health Organization Director General as ministers of health globally using Zoom technology. So there is enough technology to allow work to proceed, to progress, even when we are saying let's not be close to each other.
Let me just get clarity. Everybody coming into Zambia, they be a citizen, a visitor, they are going to go through some sort of quarantine. That is clear.
Exactly, and put clearly, succinctly, come back home or come to Zambia, but before we integrate you, if you're coming from a COVID high-risk country, 14 days quarantine. And as we improve and increase our capacity to test, we'll even test you earlier, and we'll keep a tab on you. And it is safer for the public to quarantine you. So come back, but we'll quarantine you.
Before I take another question, just for clarity, we have these 28 cases in the country now, and they are part of the first of the 2 cases that were imported into the country. And what you're trying to do now is make sure it stays in that matrix, and that we don't get new cases outside this group. That is what you're trying to do.
Precisely.
Just for clarity.
Precisely. The first cluster involves those two that came from France, and we've had no human-to-human transmission from that cluster. The rest, the 26, are all linked to the group that went into Pakistan. And so we've created a matrix that can show you who met who, and it will all pull to that visit. So what we're trying to do in being strict to admitting people in the country is to ensure that we don't create another node where we now need to start creating matrix. So countrymen and women, social distancing, stay away from contact from a possible case, stay away from a possible case. There are some of you who just innocently meet an outsider who came, say, from South Africa, where there is this case and maybe asymptomatic at a particular time.
Asymptomatic meaning?
Who may not show any signs of disease. I'm always uncomfortable with the word science because in medicine it means that, it is something you elicit as a practitioner. But for the rest of the world, yes, for the rest of us, when you don't show signs but you've got the disease and you innocently interact, yes, you're going to transmit. Remember, it's droplet, what you breathe out. Remember, it is as you cough innocently, and some, especially those who are not symptomatic, they're just trying to clear the throat and so on. They'll cough and ordinarily they'll cover the mouth and the nose. And there'll be those droplets there. And they're the ones that you'll be, will go. So that's why we're encouraging even those who are not symptomatic. As you cough, even those who are symptomatic, or those who have signs, as you cough, the elbow. That is how you cover your throat. So let us just ensure that discipline. Colleagues, this fight will only be won if all of us are collectively disciplined. It can spiral out of control. We have countries that are recording 800 deaths per day, 600 deaths per day. We have countries that have surrendered and they have given up because of the rapid human-to-human spread. Let us avoid that. Let us fight collectively at this stage when we have few cases and when we have only 2 points that we can relate to, that to explain the cases that we have. That's why do not complain when we are very strict on your relatives or your visitors who are coming in. We need to protect you, those friends of yours, those relatives of yours, and the public from any infection. So all the provinces, all the health inspectors, all the authorized officers are empowered by law to ensure that what is provided for in SI 21 and 22 is observed and do not feel inconvenience. It is in the safety, in the best interest of the nation.
We'll take the last person. Any other person? Okay. Is there somebody there behind? Yes, please.
Honorable, there's a question from the public on the use and abuse of personal protective equipment. Maybe a comment on that.
Masks and gloves.
Yes.
Well, thank you very much indeed. A mask is meant to create a barrier from the next person. A mask is meant to create protection for the next person to not get what you breathe out. A mask is also meant to create a barrier from the next person who may have exhaled or breathed out some droplets that have that infection. When do we use a mask? Well, one, you use a mask because you suspect you'll be in contact with someone who is potentially ill. There are people at the airport, ports of entry, who are entertaining people who are coming in from outside. These are potentially ill. So they have to protect themselves. There are people in public institutions where they interact with many people that are coming in either to seek essential service, such as in a particular clinic, that will potentially meet people who are diseased, even if they are not symptomatic. They need to have that mask on. The mask is meant to protect you from getting the infection and also to protect the next person if you're symptomatic yourself. So as you breathe out, as you cough, you don't infect the next person. So the mask is a barrier.
Minister, if I can ask, we know that at points of entry, immigration staff, medical staff, we know in hospitals and so on, they are wearing masks. But should we all begin walking around in public wearing masks?
As the epidemic evolves, interventions will change. And there are times in the epidemic, at the first in the epidemic, when we can do such a prescription. Yeah, and as we speak now, that's not what we are saying we must do today in this country. Yeah, but there is a stage in the epidemic, and we've seen it in other jurisdictions, where at a particular stage of the epidemic, you just ask everyone to put on a mask.
But for these who've already started, I saw a lot of people myself yesterday, they already have masks, they've got the gloves. Are you concerned about disposal of these masks? Can somebody use the same masks for days, wearing the same gloves?
Well, a mask, first of all, these masks are disposable. These masks are not for use for days, months, and so on and so forth. There are different types of masks, but the common mask that you're seeing out there is not a mask you share with the next person. It's a mask that you put on today, and it's not a mask that we say you go and wash and then you repeatedly, put it on. So these masks are important to protect you from getting an infection. And like I said, you get on a flight, the people you see with masks, they don't want to take any chances. In our jurisdiction, will tell you that the risk of human-to-human transmission is now at this level, and all of us must be under masks.
Thank you. Well, countrymen and women, I think that was the brief for today. Zambia has now recorded 28 cases of COVID-19. The message from the Minister of Health is loud and clear. Stay home if you can. Only leave if you must. If we don't move about ourselves, we will not then spread the virus, and we will save lives. I think that we all have to look deep inside ourselves of personal discipline to be able to practice personal hygiene. I'm being told that there is somebody really pushing to ask the question on behalf of the public. So the last question.
The last question. Someone is asking, we have seen medical personnel in other parts of the country getting overwhelmed. How will you choose the shifts of the medical personnel that are attending to those that are infected? She has given an example. You do see some shifts go from 7:30 to 16 hours and from 18 hours to 7:30. Are we still treating the shifts as we were in the wave of the
Has our health system been overwhelmed, Doctor?
Well, thank you very much for that very important question. His Excellency, the President of the Republic of Zambia, Dr. Edgar Chagwa, yesterday posted on his Facebook page a very important message thanking the health workers at the front line who were looking after the cases that were admitted in our isolation facilities. That message was very well received, and it urged us on as health workers, and it encouraged the frontline staff to continue in a patriotic manner to save the nation, and that is leadership. The health workers at the front line are sacrificing a lot. If we were to take a deep, just a look into what's happening at our isolation facility today at Levy, at any one time, if you look at everybody involved in the cascade for case management, from diagnostic to nursing to management to cleaning to everyone, there you have at least 50 people who are at this institution where we're managing patients. These 50 people work 24 hours in a day for 2 weeks continuously. They just juggle around and play, and they just juggle around to say, look, even if you have to take a break within that 24-hour period, you cannot leave your jurisdiction. So they are on shift 24/7.
Even the health workers are in quarantine, so to speak.
So those health workers, the shift is 24 hours, and if there's any break in between there, it's within the institution. And they are the ones managing our positive cases. Continuously for 2 weeks, they don't go home. When they finish these 2 weeks, these 50 health workers are now given another period, another area of stay in quarantine away from home, so that we ensure they are negative before we allow them to join their families. So they're basically staying away for a month. 2 weeks at work, 2 weeks in quarantine, that's when you get back home. So there is this cycle. There's always a 50, either working or in quarantine or resting at home, and the cycle is that's why there is an urgent need to increase the numbers of human resource for health. This is the reason why President Lungu, in his wisdom, directed the recruitment, preferential recruitment of frontline health workers to reinforce his fight against COVID-19. And we are pursuing the directive to recruit 5,000 new frontline health workers to ensure that we're able to manage the cases as they reach our facilities, and also are able to manage the surveillance and the contact tracing. And remember, in a multi-sectoral approach, in a One Health approach, in a One Government approach, we have many other players from other sectors that are working together with this to increase the numbers of people who are involved in the response. The approach, the response is multi-sectoral.
Great insight, Minister. Thank you so much for that question. I think that we should all truly applaud our frontline staff, the health workers, and of course we know that at the point of entry where we're trying to save the country from further new cases, we have immigration workers. And let me also, on behalf of government, also thank you, the media, who are facilitating this, because you're also frontline workers. We've tried as much as possible with these press briefings to reduce the numbers so that we all observe social distancing. We can only win this fight against COVID-19 if each one of us takes personal responsibility to care.
Coronavirus Update was brought to you in association with Hygienics Hygiene Soap, an effective way to fight coronavirus. Hygienics, you're safe in our hands.